6 months ago today, the CDC confirmed the first case of COVID-19 in America. And now we're at well over 3.8 million cases. And the last 6 months have changed all of our lives. Here are a few things to make you a little bit smarter. So let's retrace our steps a bit. The first confirmed case of COVID-19 in America was a 35-year-old man who had recently traveled to Wuhan, China, the place that we believe is the site of the first outbreak of COVID-19. What you should know is that he was really sick. He was hospitalized and given supplemental oxygen. The CDC at the time said they believed that the risks to the American public still remain low, although they were watching the potential for person-to-person spread of COVID-19. Just a few weeks after that first confirmed case, a CDC doctor during a press briefing said we should all prepare for severe disruptions to our lives, but few of us knew what that really meant. And just a few weeks after that, the US federal government shut down the entire US economy to blunt the spread of COVID-19. It's easy to forget this, but 6 months ago, we weren't even calling COVID-19 COVID-19. We were often referring to it as the new coronavirus. That's at least how the CDC was referring to it. The World Health Organization in mid-February decided to call the new coronavirus COVID-19. It stands for Coronavirus Disease 2019, but it's really a made-up term. What you should know is that COVID-19 is the disease that the new coronavirus causes. The new coronavirus is actually SARS-CoV-2. We pause here for a moment because it's really important to understand how much our language matters. Just think about this. Instead of calling COVID, COVID, what if you called it SARS? Would you think about it differently since day one? 6 months ago today, we were told that the most common symptoms for COVID-19 included fever, cough, and shortness of breath. And what you should know is that that's still consistent to this day. However, we're continuing to watch GI symptoms that are commonly associated with COVID as well. In fact, in a recent study by the CDC, about half of patients showed that they also had GI symptoms, nausea, vomiting, and diarrhea. There's a lot of research being done in how we shed the virus, how we spread it, and some believe we do so when we go to the bathroom. It's one of the reasons why there are scientists looking at sewage systems as an early point of surveillance to find out when the virus might be present in a community before we even realize it. That is definitely something we were not talking about 6 months ago. 6 months ago, health officials really thought you were at a higher risk for a severe case of COVID-19 if you were older. And what we're learning is that it seems to be pre-existing conditions that put an individual at a higher risk for hospitalization and death. When we learned about the first case of COVID-19 in America in January, the CDC did not confirm the first death until late February. Over the last several months, there's been a big question about just how deadly COVID-19 truly is. And because the data is changing all the time, it is a tough question to answer at this exact moment. What you should know is more than 140,000 Americans have died from this virus. And of those deaths, half have happened in 5 US states: New York, New Jersey, Massachusetts, Illinois, and California. We're going to use California as an example in just a moment. 6 months ago, the CDC said they really didn't believe that any face coverings would help stop the spread of COVID-19. That was different from what we heard in our own reporting from doctors who said the new coronavirus is a respiratory illness and face coverings would be effective, albeit they weren't sure how much. The CDC came out in April and said they recommended mask wearing to the American public. And as you know, there's been a lot of debate over this. There is a growing body of research that is suggesting that mask wearing is helpful to blunt the transmission of COVID-19. But even in areas like San Francisco, California, where masks were required in certain places long before other areas in the country, they are still seeing rising infections. Just a quick reporter's note on journalism over the last 6 months. You may notice that we don't often cover the politics of the pandemic, and that's for a good reason. If you have a short period of time and you're looking for nonpartisan news, we want to prioritize the virus. Understanding the facts about the virus itself is key for making decisions about how we're living our own lives with our families and what opinions we may or may not have. And so, in an effort to be helpful, I want to leave you with this one fact. Despite the lockdown, shutdowns, social distancing, school closures, telecommuting, wiping down groceries, and little to no travel, one thing you should know is that as of today, nearly all US states are seeing a rise in COVID infections to some varying degree. That doesn't mean our efforts haven't mattered. It's just a reminder about how we're really sharing in this pandemic together. How have the last 6 months changed your life? And what are you most interested in learning about as you look out over the next 6? We're really interested to hear from you. Some of you have shared just how much this pandemic has impacted you personally, and we think about you every day. We so appreciate that you're trusting us during this truly historic, unprecedented time. We consider it a privilege and an honor to serve you. Thank you for your support of Smarter News. We are going to continue to work hard for you.